we started to implement those methods, and it was very, very expensive. Took a large team of very specialized people. That's what I'm most proud about, is being able to build that. And so we built those things, those pipelines, and it's very expensive. Each person we have to analyze compute power. It's like $25. Whereas a lot of other companies, really, like all the ones, they're looking at very few variants, and it's outdated. So that's kind of what we really take pride in, is the next generation of science that we're using AI in order to get better analysis. And so that's kind of, we're extremely strong in the science, and we're also, we're planning on getting our predictive models approved by regulators at some point. So that's why we really have to be careful with how we build these things.
Welcome to another episode of the Health Coach Academy podcast. I'm your host, Omar Cumberbatch of OmarCumberbatch.com. You know me, I always look for angles to everything that can help out the health coach community. So I really get excited when I do stumble upon something that can be super valuable to us in our practices. And I think I stumbled upon a good one. And I wanted to share today's guest, Joe Cohen, who really provides a service that I think health coaches should take super advantage of. And it's really something that I think, as a health coach, one of the things that I always felt like, and this could be just something that I come across personally, but I think there's a lot of value in data. I think there's a lot of value in providing a health coaching client something that they can look at tangibly and see whether or not there's something specific going on with them. So in other words, if we run labs or have blood tests and such, we really have an advantage, because we can look at data and say, hey, you're low in this, you're high in this isn't working, this is not something that you should be partaking in. I think that's very valuable. And one of the things that I think is coming up on the horizon, and Joe is going to explain that specifically today, is the role genetics play. Now, as a health coach, we always think of the term like bio-individuality. And when we talk about that in that context, it means just that we're absolutely all different. One diet does not fit for everyone. And that's something that's really important. So Joe joins the show to kind of double down on that, right? And he's the creator of SelfDecode, which is considered by many as the ultimate biotech software platform for DNA and lab-based health recommendations. So I want you to get your pens out, take some notes. This is something that I think would be very valuable to the health coach community. As always, please leave a rating and review on iTunes. It goes a long way for me to continually get great guests like Joe. Here's Joe Cohen. Hey, Joe, welcome to the show. How are you today?
Hey, Omar, thanks for having me.
Oh, my pleasure. I'm really excited to share you and your company with the health coach audience, because one of the things that I feel like health coaches have maybe a little bit of a disadvantage is really like raw like data and stuff that we can make reference to our clients that can really show them where their like shortcomings are. And one of the things that your company is really impressive. So I wanted to let you give me a little bit of background about yourself and how you became so involved in genetics, and really how you came up with the SelfDecode.
Yeah, definitely. So I was always one to have a lot of health problems, just in just about every area growing up, just from an early age. And I was also pretty independent, but I tried to get help, and the system wasn't really helping me. So that's when I knew I had to figure things out on my own. So that's what led me into really being just really into health and understanding my body, because I realized that the tools weren't there. The information, the tools, the technologies weren't there to help me do what I needed to optimize my health. And we're talking about improve my mood, get more energy, improve my immune system, improve my cognitive function, improve my gut health. I mean, I was just a mess from every area you can think about. And it was really impacting my day-to-day performance. And so I think I'm someone who really thinks that optimizing your health is the best investment you can make. And I was doing a lot of health coaching once I was able to make very serious improvements on my body. And so I started doing health coaching. I had the website self-hacked and I was getting a lot of people, a lot of readers there. And then I ran into a problem where I found that I didn't have genetics, or I didn't have the software in order to deal with the incoming data that I was getting. And so that's what set me out on building the tools to be able to allow people to figure out how to improve their health, and also to allow health coaches to do their jobs better.
All right. So where did you grow up?
I grew up in Brooklyn.
Oh, okay. So I'm just curious because you're telling the story of an American issue. Like, we do not seem to have the healthcare infrastructure that can get into like some of the concerns that you had. I'll give you a lot of credit. I want to also ask you, how old were you when you started making that observation about the lack of, support that you were getting in the traditional healthcare system?
That's a good question. I mean, there were kind of different stages of realizations.
Mm-hmm.
And so I came from a family that was very skeptical of the mainstream medical establishment. And so already from the age of like 13, it was just like, I don't think the doctor knows anything that's going on, really. Not with what was going on with my issues. Maybe if there was a certain kind of condition or whatever, but I was just very skeptical. I was just thinking that most of the problems people have, and I still think this today, is because of an unhealthy diet and lifestyle. And so early on, I was just always into improving my diet and lifestyle.
Mm-hmm.
So that was kind of stage one. And I was, at 13, improving my diet was eating whole wheat bread.
Mm-hmm. Yeah.
And so, and it was, good quality whole wheat bread, probably be considered like Ezekiel bread, something like that. But, getting older, though, I was becoming unhealthier over time.
Mm-hmm.
And the issues were getting worse. And even though I was like, doing all the things that people were supposed to do to be healthy. So that's when I realized that following the different people's health advice is just, about diet and lifestyle is not what is making a big change here. And so that's when I started to become more independent, because I was really just trying to follow different people. It's like, okay, this person says, if you do this diet, right, like a plant-based diet, you're not going to have, it's going to fix everything, whatever. And then I try it and then didn't help, at all. Probably maybe even made things worse. And then I tried keto. I tried different kinds of things, very low carb. And there were different problems with each thing. But just following people's advice exactly was not, didn't really help me. And so I knew that each person was an individual, and what helped them, like, it was just clear that people were giving advice on like what was helping them, and maybe they were attracting people that were, that were being helped by that. But what was really important was having a individual approach to treatment. And that's kind of what got me into genetics, precision health, lab tests, like really looking at the individual and understanding how is this person different from other people, right? Because one therapy, drug, lifestyle approach, diet does not always, it usually doesn't always work for the same person, right? Even if I find someone very similar to me and a lot of the same things help them, there's going to be a lot of things that they respond differently to. And so that was kind of the theory. And at that age, I was, when I realized that, I was about 24, 25.
So at that point, obviously you stumbled upon the idea, which is a great eureka moment, honestly, because it is a leap, because a lot of our primary care doctors, I mean, I've been to doctors, I've never even heard of the word genetics come out of their mouth. So to make that leap to just understand the bio-individuality of an individual is pretty huge. So did you start trying to figure out how to get genetic markers for yourself first, or did you go into it in a different direction after your healing journey?
Yeah, so I guess it wasn't necessarily the first thing. My first thing in the healing journey was trying out things one at a time and seeing how things worked individually. So I started with the diet. It was just try out one food for like 12 hours and see how I felt,
Mm-hmm.
which led me to eventually to the diet that I have, through process of elimination. Like this food is works, it's on this level and that level. And the diet is just, it's a grain-free, grain and bean-free diet. And then I also happen to be allergic to like eggs and shrimp,
Mm-hmm.
different kinds of allergies, but and then it's also dairy free. So that's the gist of it. And then the other things are just moderation. But I started with diet, and then I also was doing lifestyle stuff, and then I also went on a long process of experimenting with supplements, which I had been doing a lot of experiments before on supplements, but I'd say most of it was like formulas or just taking like a minimum dosage because I didn't really, wasn't sure. You'd read stuff online that, this is going to cause cancer, this is going to do this and whatever. Like you don't really know what's going on.
Right, right.
And you're just like a little concerned, like too much of this is going to, whatever. And so I was just like, okay, let me just take a little bit just to make whatever. And I was trying like different formulas, maybe some B vitamins, but nothing really. I wasn't really like I wasn't that seriously into it. And then I did get much more seriously into it for a while, probably like when I was 20. I was taking a lot of supplements at that point already. Not a lot, but a fair amount.
Mm-hmm.
But they were all in like mixes, right? So
Mm-hmm.
I didn't really know what was doing what. It was
Right,
just
right.
like I'm taking this every day and I'm hoping this is going to help me but and it didn't really work out for me that much
Mm.
because it
Yeah, no,
wasn't personalized for me.
right, right, right. Yeah, so it definitely seems like you've been funneled into the direction that, genes was just really the next frontier for you and your research and just basically how you discovered your company. So just tell us a little bit about SelfDecode itself and what is it? Because I think this is really exciting for health coaches to maybe have an opportunity to jump in on this for that data that, I mentioned earlier. So can you just get into SelfDecode? What's your structure of your company and how it can help health coaches?
Yeah, so we have a coaching platform where SelfDecode has there's a couple different parts, but there's basically a genetics platform where you can get tests for a whole variety of topics, whatever you want to know really for your client. Like, what are they at risk for? What are personalized recommendations for this topic? And so that's kind of one element. Another element is you can upload labs and see which labs are out of the optimal range and get information recommendations. And then you could also send your client assessments that ask them questions and see what they're doing in their lifestyle that may be increasing their risk for something. So that's kind of like those are the three layers, with genetics being the most significant one.
Mm-hmm.
And then we have also we built out tools for practice management, including the ability to take notes, the ability to order a customized supplement, download various kinds of reports for your clients, order different kinds of lab tests for your clients, and also create your own questionnaire, just your own intake form. And quite soon, we're also going to be having a client portal where you can easily upload things to that portal, HIPAA compliant portal that your clients can see. And so we're building out like different functionalities in order for it to be like a very comprehensive practice management software that includes HIPAA compliance. So we're building out like an EHR plus an easy ability to order online whatever tests you want, and also a whole decision support system with genetics and labs and lifestyle assessments.
So when we order something, how does that happen? Do you have like a doctor on staff who's basically prescribing these labs so that we are able to order the various genetic tests and labs that you offer?
Correct.
Oh wow. See, that's awesome because again, that as health coaches, we don't have the availability or ability, I should say, to do that on our own. So you have a group that actually helps in facilitating that.
Correct.
Oh, that's awesome. So how hard is it when we get these results back for a health coach to interpret the results?
They're very easy. It's very easy. It's written in a very easy format for health coaches to be able to interpret.
Okay, so basically, in the lab results back, the reports will give us some, an assessment of what's going on, and really maybe even some indication of what we need to do as far as next steps.
Yeah.
Oh wow, yeah, this is great. That is so cool. Now,
Yeah.
yeah, so like I'm just like envisioning how health coaches could utilize it. So I have a client who has say gut issues, and then there's categories and such where we can order labs and genetic tests specifically for gut related issues, and then at that point when we get the feedback we can actually work with our clients to correct it. So this is awesome for the ability to have some compliance, of course, but just really to have the ability to have the results that probably have been escaping them for years. So this sounds really exciting.
Yeah, I agree. I mean, it's the first platform of its kind to do all these things. Even just the genetics platform, the comprehensiveness, the interactiveness, and it's like a clinical decision support for health coaches and functional medicine. There's nothing like it. So like you could see every recommendation, what it's doing with what is it helping with, what the client has high genetic risk for, and so you could build out a regimen for your client based on what's found in the reports, and then you can download that regimen very easily and send it to the client.
Oh, that's great. So what kind of issues have you uncovered when you took a look at genes overall? I'm just curious because I know that it's kind of uncharted territory, probably for a lot of health coaches at this point to get. What interesting things have you found, and how have you been able to correct it through your company?
So I've found quite a lot of things. It'd be difficult to go through everything, but
Yeah, some
just
highlights. Yeah.
yeah, some examples. Number one is it's found that I was high risk for mental health issues, right? And that's something that
Mm,
I'm aware of just because I dealt with mental health issues in the past.
mm,
But it highlighted the right recommendations for me that that I wouldn't have been able to figure out otherwise. And so, it for example, it told me that, just as an example, it told me that I needed 5-HTP for the different mental health issues that I was
mm.
having. And I took the 5-HTP. I felt a lot better, and that was it. It turns out that so far to this date, that's the only thing that really works the best for me, and
Mm.
that was prioritized. It came up high as a prioritized recommendation based on my genes, and now we make it even easier. We build out a recommended regimen or supplement for people that they can choose to add or subtract what they want, but it's kind of like a base. This is what we predict, and then a health coach or whatever can look at that and be like, okay, let's minus this or add this or whatever. But mine was actually pretty on par. I would say it was extremely on par with what was very good for me in general, like things that I like taking. And as an example, like I have a friend. He's a entrepreneur, big company. I mean, reasonable sized company, 200 people in San Francisco. And I was like, okay, what kind of? I know him pretty well, so I was just curious what kind of thing he got, because he was telling me he didn't do well with, like, he didn't find that the 5-HTP was like really useful for him.
Mhm.
So I said, what was his recommendation? He said it didn't have the 5-HTP. It had different supplements. So, but it was just quite interesting that he said he did really well with theanine, and I don't notice that much of an impact from it.
Hmm.
And it came up on his and not on mine. So it's just kind of interesting things like that where you can get this personalized supplement. But each I would look at the, it basically it allows you to look at the what your highest genetic risks are.
Hmm.
And then you can look at like very comprehensive reports and recommendations and see like what are the prioritized recommendations based on your genes. And you can build a regimen or download the reports, send it to your client. You could do a bunch of stuff with it.
Well, yeah, no, that story actually really brings out like the precision of the testing, like, similar maybe issues, but completely different remedies that are required to assist in getting over that. So that's very powerful in that
Yeah.
respect as well.
And this guy, by the way, also our biologies are actually pretty similar.
Mm.
Just he was been following me for since 2013 already. He's one of my
Well,
first followers. He was telling me that a lot of things, almost like most of the things, almost everything that works for me works for him. It was just a couple differences, and it was just funny that those things didn't show up on the personalized supplement.
wow. Yeah, no, that is really interesting. So I was just really curious, like, as far as how does it work where the collection of like this, I guess the blood, is it blood? Is it something saliva? Is it a third party company that assists in providing you with the stuff that you need to run these types of tests? Can you talk about that a bit?
It's saliva,
Mm-hmm.
and you just order a kit from our website, and we get it sent to you anywhere
Mm-hmm.
in the world. If you have a client, almost anywhere in the world, most countries, but definitely in the U.S., Canada, and Mexico, and so North America, but most countries in the world, and then you can either get it sent for your client or you can get it for yourself as well. Yeah, and it's pretty much it. You spin in a kit and send it back.
Oh wow, that's easy. So
Yeah, pretty easy.
yeah, so as far as like the cost for these things, is this something that the health coach has the opportunity to like go into memberships, or is it as pay as you go kind of thing?
So there's a membership. It's $6.99 a year.
Hmm.
Yeah, so that's I mean that's our current pricing model for what you get. I mean, you could do it by the month, but the yearly is just more worth it.
Right, right, and that gives you a certain amount of tests that are available to use.
Yeah, so I mean, you get to use right now it's 100,
Hmm.
so it's you get quite a lot of tests.
Yeah, no, that's really a great price point for health coaches at this, especially for the information that you're getting. That's a very, very reasonable. So it's I could see the importance of jumping on it soon because as you take off even more, I could see that price going up.
It will be going up. That's why I'm a little hesitant to say the price because I'm just like
Did you want me to
I'm like
chop that out?
no, it's fine. You can keep it in there. I'm just like, but it's just like I'm like, should I get that a price out? Because then people are gonna listen to it later. You can keep it in, but I'm just saying, like, that's why I'm a little hesitant to just say the price. But yeah,
No, I hear you. I hear you. Yeah, it's just absolutely feel free to hit me up and we can make an adjustment. But yeah, it's that just so the audience obviously knows, everybody listens to podcasts at different times and they're kind of eternal. So don't expect it to be the same price if
right.
you listen to this 3 years down the road. So I could dig it. I could totally dig it. So yeah, listen, Joe, I think this is fascinating. I think there's a lot that health coaches can utilize. Is there anything that maybe after this conversation here that I have missed that you want to add about SelfDecode?
No, I think we covered a fair bit. I mean, I think it's a little hard to explain the science. I mean, in a short amount of time, but
Yeah.
the science that we have is one of the differentiating factors. I mean, we're looking at 83 million variants, whereas within this industry, the vast majority of companies are analyzing 100 variants or less.
Really? Wow.
Um, yeah, it's just we're using like a different scale of analysis that we were using. I've been around since 2016, and 2016, 2017, 2018, and even 2019, we were using like the older analysis where we maybe analyzed, I don't know, like 50, 100 SNPs, anywhere between 20 and 100 SNPs per report, which then was the most. But then we really said, like, how do we take this to the next level? And it was really cheap to do that. Like, to analyze someone's file was like less than a cent. But then we started saying, like, okay, the new research has come out that if you use AI machine learning, you can take this, it can be 10x more predictive.
Wow.
And so we started to implement those methods, and it was very, very expensive. It took a large team of very specialized people. That's what I'm most proud about, is being able to build that. And so we built those things, those pipelines, and it's very expensive. Each person we have to analyze compute power. It's like $25. Whereas a lot of other companies, really, like all the ones they're looking at very few variants, and it's outdated. So that's kind of what we really take pride in, is the next generation of science that we're using AI in order to get better analysis. And so that's kind of, we're extremely strong in the science, and we're also, we're planning on getting the our predictive models approved by regulators at some point. So that's why we really have to be careful with how we build these things.
Mm. Yeah, now listen, I mean, that's a super separation from your competition. So, I mean, that's, like you said, well above 10x kind of numbers. So, yeah, I could definitely see the value and being able to also just have a selling point about how far ahead that you are from your competition. It is truly impressive. So, Joe, you've been amazing today. I'm really excited. I'm jazzed to dive deeper into SelfDecode and take a look at the website even more. I did a lot of research on you individually, and then I popped over to the website and took some things, but you really helped me understand it a lot better and the services that you provide. So I thank you for that.
Yeah, thanks. I appreciate the conversation. Thanks for having me.
No, my pleasure. So yeah, tell us please how to keep up with all the good stuff that you're doing and all the new and improved research as it goes along and grows with you. Obviously your website, social media handles, anything that we can keep up with you going forward.
So people can go to selfdecode.com. That's self, SELF, decode, DECODE.com for the genetic analysis and the lab analysis and the professional platform. My personal Instagram is Mr. Biohacker, MR Biohacker. And people can sign up to our email list, follow me on Instagram, use the platform. Nobody is going to regret using the platform.
I know. That's for sure. So, Joe, again, appreciate you jumping on the call today, and have a great rest of your day.
All right, awesome. Thanks for having me. Take care.
Take care. Hope you enjoyed listening to today's episode of the Health Coach Academy podcast. If you did, jump over to iTunes and leave a rating and or review. It goes a long way in helping get this message out to our fellow health coaches and people in our industry. Also, if you can, jump over to my website, omarcumberbatch.com, where I give out a lot of freebies, including my 5-day sugar challenge for people who are having issues with sugar. And also for health coaches, I have the book, Hidden. It's the 6 not so obvious ways to get your clients unstuck. Have a great day.